Hi, my name is Mary Courson-Cataldi. The purpose of my speech is to inform about the physical effects of speech anxiety. Speech anxiety affects your body greatly, from physical ailments to decreasing your chance of job promotion, believe it or not. It is important to raise awareness. Did you know that speaking fear that causes anxiety is so closely related to social anxiety disorder, or SAD, that it was taken out of the most recent issue of the Diagnostic and Statistical Manual of Mental Disorders and has a 10% impairment on your college graduation rate? It also has a 10% chance of impairing your wages later on in your chosen job field. In order to combat such life-altering occurrences, you must first fully understand what physically goes on in the brain during public speaking anxiety. After fully understanding fear of public speaking, this speech will explore a study that introduces methods to reduce these negative symptoms related to speech anxiety. Symptoms of public speaking-induced social anxiety disorder cause an individual to act in a humiliating way that make he or she feel as if their actions will lead to rejection, embarrassment, or offensive behavior like blushing, shaking, or sweating, for example. Other symptoms of anxiety caused specifically by public speaking include increased heart rate or palpitation, nausea, breathlessness, dizziness, and in some cases loss of consciousness. In very rare cases, an individual will begin to display some avoidance behavior, which means that they will avoid any type of public speaking or sometimes social situations at all. When considering this phenomenon physically, the frontal lobe of the brain can cause the widest variety of symptoms because it controls things like motor function, problem solving, memory, impulse control, language, and even social behavior. The frontal lobe of the brain is extremely sensitive to hormones that anxiety causes. These hormones are called adrenaline and cortisol, and the precursors for these hormones are called DHEA. When these hormones become overactive, the body enters what is called a fight or flight response. I'm sure you've heard of it. A fight or flight response is simply the brain telling the body that it needs to feel threatened, and the body feeling that an immediate action is required. Although, technically, giving a public speech is not considered a life-threatening situation, your frontal lobe does not discriminate between the two. So when your brain communicates to your body that you are in life-threatening danger, your body begins to physically react. Although speech anxiety can be very scary and make you want to completely avoid giving speeches or some social situations altogether, there are steps you can take to alleviate symptoms. First and foremost, you must change the way you view the big scary monster known as your speech anxiety attack. When delivering your speech, if you begin to have symptoms of speech anxiety, it's okay. Do not dwell on these symptoms, it will only make them worse. Setting standards for yourself that are unrealistic will increase these stress hormones that your body is letting off that you are trying to decrease. Practice makes perfect. It is important to practice your speech, but not to memorize it. When you memorize your speech word for word and then forget part of your speech, you begin to activate these nasty stress hormones again. Instead, use note cards with key phrases, pictures, or colors that can jog your memory. Practice recovering from symptoms of speech anxiety, as it is completely normal. The more you get used to the idea, the less likely you are to dwell on the situation if it were to arise. Always remember to breathe because it increases blood flow to the frontal cortex. Thank you so much for your time in listening to my speech. I hope it was helpful.